IELTS, International English Language Testing System, Part 152. Reading Passage 2. Sleep apnea. Sleep apnea is a common sleeping disorder that affects a number of adults comparable to the percentage of population that suffers from diabetes. The term apnea is of Greek origin, that means without breath. So the sufferers of sleep apnea stop breathing repeatedly while they are asleep. This can happen hundreds of times during the night. Each gasp lasting from 10 to 30 seconds. In extreme cases, people stop breathing for more than a minute at a time. Well, there are three different types of sleep apnea, with obstructive deep apnea being the most common. Obstructive sleep apnea, OSA, which affects 90% of the sleep apnea sufferers, occurs because of an upper airway obstruction. A person breathing stops when air is somehow prevented from entering the trachea. The most common sites for air to get trapped include the nasal passage, the tongue, and the tonsils, and of course the alveoli. The fatty tissues or tightened muscles at the back of our throat can also cause the obstruction. The central sleep apnea has a different root cause, though the consequences are the same. In central sleep apnea, the brain forgets to send the signal that tells the muscles that it's time to breathe. The term central is used because this type of apnea is related to the central nervous system rather than the blocked airflow. The third type of sleep apnea is known as mixed apnea, and it is a combination of two and is the most rare form. Fortunately, in all types of apnea, the brain eventually signals for a person to wake up so that the breathing can resume. However, this continuous pattern of interrupted sleep is hard on the body and results in very little rest. Sleep apnea is associated with a number of risk factors, including being overweight, male, and over the age of 40, they can certainly get overweight. However, like many disorders, sleep apnea can affect children and in many cases is found to be the result of a person's genetic makeup. Despite being so widespread, the disorder often goes undiagnosed. Many people experience symptoms for their whole lives without realizing that they have a serious sleep disorder. Oftentimes, it is not the person suffering from the sleep apnea who notices the repetitive episodes of deep interruptions, but a partner or a family member sleeping nearby. The air cessation is generally accompanied by heavy snoring, loud enough to rouse others from sleep. Those who live alone are less likely to receive early diagnosis, though other symptoms such as headache, dizziness, irritability, and exhaustion may cause a person to seek medical advice. If left untreated, sleep apnea, which is a progressive disorder, can cause cardiovascular problems as well. It can increase the risk of a heart disease and a heart stroke. Sleep apnea is also blamed for many cases of impaired driving and poor job performance. In order to diagnose sleep apnea, patients are generally sent to sleep center for a photosonography test.